This talk is a summary of the Treatment of SSRI-Resistant Depression in Adolescents study, also known as TORDIA. This is a major study in the field of child psychiatry published in 2008. It was a randomized controlled trial with the objective to compare effectiveness of different treatment strategies for adolescent MDD after initial SSRI treatment fails. The sample included 334 patients who were 12 to 18 years old and were diagnosed with MDD, as indicated by a CDR-SR score of at least 40, and failed an adequate trial of an SSRI of at least 2 months duration. The patients were randomized to 4 different treatment arms: a switch to a second SSRI, either citalopram, fluoxetine, or paroxetine, a switch to venlafaxine, a switch to combined treatment with CBT plus a second SSRI, or a switch to combined treatment with CBT plus venlafaxine. The patients were treated for 12 weeks and were assessed for clinical improvement, depression, and suicidal ideation at baseline, 6 weeks, and 12 weeks with the CGI, CDR-SR, BDI, and SIQ Junior. The switch to either treatment arm with CBT had a greater response rate than the switch to either non-CBT treatment arm. However, there was no significant difference between any of the treatment arms in their effects on depression and suicidality scores. That is, although all treatment arms caused some reduction in depression and suicidality scores, there was no treatment that was significantly better than any of the others. This also means that there was no difference between antidepressants in terms of effectiveness. However, there was a difference in side effects. There were worse side effects overall in subjects switched to venlafaxine than in subjects switched to a different SSRI. Here are additional results that may be of interest rounded to the nearest whole number. You can see that the response rate was different between treatment groups with no CBT compared to treatment groups with CBT, and that the effect of adding CBT can be summarized by an effect size of 0.3 and a number needed to treat of 7. The authors concluded that when treating adolescent MDD unresponsive to treatment with an SSRI, the best next step is to treat with CBT plus a second SSRI when considering both efficacy and tolerability. Here is a visual to summarize the results. In summary, when considering adolescent MDD treatment, switching to a treatment strategy involving CBT is more effective than only switching the medication. In terms of efficacy, switching to a second SSRI is just as effective as switching to venlafaxine. That's the end of this talk. Thank you.